President Trump and chronic venous insufficiency. What's going on with his health? Hey everyone, welcome back to the channel. Today we're diving into something that may be affecting a lot of people, especially as we get older. Chronic venous insufficiency, or CVI for short. It's one of those conditions that's more common than you might think, and while it's often overlooked, it can have a significant impact on your daily life. So, what exactly is chronic venous insufficiency? Well, let me break it down for you. It's a condition that happens when the veins in your legs can't efficiently pump blood back up to your heart. Instead of flowing smoothly, the blood starts to pool in the lower legs, causing swelling, discomfort, and that all-too-familiar heaviness. If you've ever felt like your legs are aching after standing or sitting for too long, this might sound a bit familiar. It can also lead to tingling, cramping, and in some cases, even skin changes or ulcers. The main culprit behind CVI is damaged one-way valves inside your veins. These valves are supposed to prevent blood from flowing backward, but when they're weakened, blood starts to back up. Over time, this can create a whole host of symptoms that can really interfere with your day-to-day activities. Now, what are some of the risk factors for CVI? Well, blood clots, varicose veins, being overweight, and simply standing or sitting for long periods are all contributors. And while it's most common in older adults, younger people can experience it too, especially if they have a family history or other risk factors. Diagnosing CVI usually involves a simple test called an ultrasound. This helps doctors check how well your veins are functioning and rule out other potential issues, like heart disease or kidney problems, which could be causing similar symptoms. So, how do we treat CVI? Well, for most people, the treatment plan is pretty straightforward. Compression stockings, which help improve circulation, are one of the first things your doctor might recommend. Elevating your legs and maintaining a healthy weight are also essential. And don't forget, exercise. Walking, in particular, is great because it strengthens the muscles in your legs and helps support your veins. But in more severe cases, treatments might include medications or even medical procedures, such as laser therapy or vein stripping, to fix the damaged veins. Now you might be wondering, does anyone famous have this condition? Well, yes. President Trump's health has been the topic of many discussions, and one of the conditions he's been known to deal with is chronic venous insufficiency. It's a reminder that even those in the public eye aren't immune to these common health issues. But here's the good news. CVI is manageable, and with the right care, most people can lead a normal life. If you're noticing symptoms like swelling, aching, or heaviness in your legs, don't wait too long to get checked out. Early treatment can make a world of difference in how you feel. 2. Now, what causes this condition? Well, age is a big factor. As we get older, the veins in our legs naturally become weaker, and those valves can start to fail. But there are other risk factors too. Things like blood clots, standing or sitting for long periods, obesity, and even family history can increase your chances of developing CVI. In fact, chronic venous insufficiency is a leading cause of leg swelling in older adults. But before we jump to conclusions, we need to make sure there aren't other, more serious conditions at play. For instance, heart disease, kidney problems, or blood clots can cause symptoms that look a lot like CVI. That's why a doctor will often use an ultrasound to look at the veins and make sure that the issue is CVI and not something else. Now, when it comes to treatment, the good news is that for most people, the solutions are fairly simple and effective. The first line of defense is compression stockings. These help improve circulation in your legs and reduce the swelling. Elevating your legs in regular exercise, like walking, can also work wonders. Exercise strengthens the muscles in your legs, which helps support your veins and improve blood flow. But controlling your weight is probably one of the most important factors. By maintaining a healthy weight, you're reducing the pressure on your veins, which can prevent or even reverse the symptoms of CVI. If you're carrying extra weight, your veins have to work even harder to move blood against gravity, which can make CVI worse over time. In more severe cases, where there are ulcers or other complications, medical procedures like laser therapy or surgery might be necessary. But for most people, managing symptoms with lifestyle changes and support from their healthcare team can keep things under control. It's interesting to note that even public figures like President Trump have dealt with health issues related to CVI. Trump's health has been a topic of much discussion, and it turns out he's not immune to this common condition. But here's the thing. Just because someone in the public eye has it, doesn't mean it's something to be embarrassed about. CVI is more common than you think, and it's something that can be managed effectively with the right approach. So, if you're dealing with swollen or painful legs, don't brush it off. Talk to your doctor, get checked out, and make sure you're taking the right steps to manage your health. Whether it's wearing compression stockings, getting more active, or losing a few pounds, small changes can lead to big improvements. Chronic venous insufficiency is more than just swollen legs or discomfort. It's a condition that can really disrupt your quality of life. If you've ever experienced that nagging feeling of heaviness or pain in your legs, or if your legs tend to swell up after a long day, you might be dealing with CVI. What happens is that the veins in your legs are no longer functioning as they should. Typically, veins have one-way valves that push blood upwards toward your heart. But when those valves get damaged, often because of things like blood clots or inflammation, the blood starts to back up, and that causes the swelling, pain, and in some cases even ulcers or sores on your legs. What's tricky about CVI is that it's not just about discomfort. If left untreated, it can lead to more serious complications, like leg ulcers, or even problems with mobility. Imagine not being able to walk as easily, or having to adjust your daily routine because your legs just aren't cooperating. That's the reality for many people with untreated CVI. Understanding this condition is key because early detection and treatment can make a big difference. For example, if you can catch it early, you can start using compression stockings, elevate your legs, and exercise to help improve circulation. These simple steps can go a long way in managing the symptoms and preventing more severe issues down the road. Now, let's talk about the core of CVI, the veins and their valves. Think of them like little gates inside your veins that prevent blood from flowing backward. When these valves are damaged, whether from a clot, inflammation, or just aging, blood can start to pool in the veins, and that's when the real trouble starts. The increased pressure in the veins leads to swelling, which is why you often feel that heaviness and discomfort. This is the underlying cause of CVI, and it's why treatment focuses a lot on supporting those veins and their valves. But here's the thing. Swelling in the legs can have many different causes. It could be related to heart disease, kidney problems, or even deep vein thrombosis, a blood clot. That's why it's so important for doctors to rule out these serious conditions before diagnosing CVI. Once those dangerous possibilities are ruled out, it's time to focus on treating CVI itself. And how do we confirm CVI? Well, the gold standard for diagnosing this condition is a Doppler ultrasound. This non-invasive test helps doctors see how well blood is flowing through your veins and check if there's any clotting or damage to the valves. It's a safe, accurate way to pinpoint the problem and determine the best course of action for treatment. By the way, this is a condition that even affects high-profile figures, like President Trump. Yes, Trump's health has been a topic of discussion, and one of the issues he's faced is chronic venous insufficiency. It's a reminder that CVI is not just something that happens to the elderly. It can affect anyone regardless of their status. The good news is that CVI is treatable, and the earlier you catch it, the easier it is to manage. With the right treatment plan, like using compression stockings, staying active, and making healthy lifestyle changes, many people can keep symptoms under control and maintain a good quality of life. So, if you're noticing any signs of CVI, like swelling, pain, or heaviness in your legs, don't ignore it. Talk to your doctor, get the proper tests done, and start treating it early. Your legs will thank you. 4. So, let's break it down and talk about the treatment options available, from lifestyle changes to more advanced medical interventions. First, let's start with some of the simple yet effective ways to manage CVI through lifestyle changes. One of the most important steps is using compression stockings. These stockings apply gentle pressure to your legs, which helps to push the blood back up towards your heart. It's kind of like giving your veins a little help, especially when they're struggling. Pair that with elevating your legs whenever you can. This simple step reduces the pressure in the veins and encourages better blood flow. And here's where the power of exercise comes in. Walking, for example, is one of the best things you can do for your legs. It strengthens the muscles in your calves, which in turn helps to pump the blood back up your legs and reduces the swelling. You might think of walking as just a nice activity, but for people with CVI, it's actually a vital part of managing the condition. Also, maintaining a healthy weight is crucial. Extra pounds can put added pressure on your veins, making it harder for them to do their job. Losing even a little weight can make a noticeable difference in how your legs feel, so it's something to really keep in mind. But what if the condition progresses, and those simple measures aren't enough? In more severe cases, when you start seeing symptoms like ulcers on your legs or intense pain, we need to take things up a notch with medical treatments. Anti-inflammatory medications and drugs that help tighten the veins can be prescribed to improve circulation. In some cases, more advanced treatments, like sclerotherapy, which involves injecting a solution into the veins to make them collapse, or even surgery, might be necessary to help the blood flow properly. Now here's the thing. CVI is a chronic condition. This means it doesn't just go away on its own, and if not properly managed, it can get worse over time. That's why regular follow-ups with your healthcare provider are so important. By staying on top of your treatment plan, you can control the symptoms, prevent flare-ups, and avoid serious complications like leg ulcers or blood clots. And most importantly, keeping up with your care will help you maintain a better quality of life. And you know, this isn't just a condition for the elderly. Even public figures like President Trump, whose health has been in the spotlight recently, have dealt with chronic venous insufficiency. Trump's health challenges serve as a reminder that CVI is something many people face, regardless of their age or status. So don't think of CVI as something only older adults deal with. It's something that can affect anyone, and managing it is key. At the end of the day, understanding CVI and its treatment options can make a world of difference in how you feel. The more you know, the better equipped you'll be to handle it. Whether it's simple lifestyle changes or more advanced medical treatments, there's a lot you can do to control CVI and live a full, active life. Thanks for watching. Let me know in the comments if you've had any experience with CVI or if you have any questions. I'm always here to help, and I'll see you in the next video.